Please
So
go ahead.
today my topic is menopause. So when you hear the word menopause, what do you think? What are your thoughts about menopause? Menopause എന്താണ്? എന്താ പറയാ menopause എന്നുള്ള ഒരു ഇതില് നമ്മള് you hear the word often, right? So what does menopause mean to each of you? Drilla? All right, so I can explain in simple sentence. So my older sister is 8 years older to me. And so if you can imagine a person who is well dressed and even wear makeup when she goes to bed. So she's that kind of a person. And she was 40 and I hosted her 40th birthday party. So we had a lot of people sitting there and I told my older sister that menopause means, so you are now 40, so you're entering menopause. Menopause means men no longer pause and look at you, because you're at a stage where nobody is going to look at you. So the first time in my life, I saw my sister bending down, taking her high heels and throwing it at me like a full speed because she got so angry with me. So technically, menopause means that when you have stopped menstruating, and it's very important because we don't talk about it. So in today's thing, what I'm trying to hope for is, I'm going to the next slide. Okay. So I'll be talking about menopause. At the end of this presentation, I hope you understand what menopause is and why and when it occurs. You need to know the symptoms, which is really important, and how to manage it. You want to understand how to take care of your health. Because basically what happens is that we are immigrants and we don't get the help that we actually need to get. And we don't know how to seek help. And these two are detrimental for our health. So you are now going to understand how to take care of your health during and after menopause. You are aware of importance of maintaining a good health during your midlife. So what is menopause? It just means that it is your final period. It's a natural process. So basically, when a girl child is born, you're born with X number of eggs in your ovary. So when the ovary runs out of eggs, that is when you will start menopause. So why does when the ovaries run out of egg, you have menopause? Do you know why that happens? അത് ഹോർമോണിന്റെ കാരണങ്ങൾ കൊണ്ടാണ്. ഓവറിയിലാണ് നമ്മൾ ഈസ്ട്രജനും പ്രൊജസ്ട്രോണും ഉണ്ടാക്കുന്നത്. അപ്പോൾ ഓവറിയിൽ എഗ് ഇല്ലെങ്കിൽ ഈസ്ട്രജനും പ്രൊജസ്ട്രോണും ഉണ്ടാക്കില്ല. അപ്പോൾ നമുക്ക് പിന്നെ ആ സൈക്കിൾ എല്ലാം റിവേഴ്സ് ആയിട്ട് വരുന്നതുകൊണ്ട്, സോ വൺസ് ദ ഓവറീസ് ഡോണ്ട് പ്രൊഡ്യൂസ് ഈസ്ട്രജൻ menopause, there's no need to have periods. So that means you're going to have menopause. So it's a process. So you have run out of eggs, so you get into menopause. നമുക്ക് clinical practice, we can also induce menopause. Chemotherapy or radiotherapy എടുക്കുന്ന patients can have menopause. You can also have, when you remove the ovaries, again, you can have menopause. That's why some of the women who have hysterectomy will leave the ovaries behind so that the ovary still continues producing the menopause, to continue producing the hormones, so you still won't get into the complications of menopause early. Okay? മനസ്സിലാവുന്നുണ്ടോ ഇത്തരം കാര്യങ്ങൾ? Okay, we go to the next one. So hormones, we all have hormones. You know what hormones are. So we have in the brain, you have the hypothalamus pituitary, we have the adrenal and the estrogens in the rest of the body. So most of the hormones that you really need to know is estrogens and progesterone. Testosterone is also produced. This hormone level change ചെയ്യുന്നതുകൊണ്ടാണ് നമുക്ക് menopause കിട്ടുന്നത്. As I said earlier, ovaries produce estrogens and progesterone, and when that goes down is when we have the problem. So why I call menopause a problem, I will explain in a few seconds. So when does menopause occur? It occurs 45 to 55 years. Average age is 51 in Australia. Now, the problem is this number is predominantly for the Caucasian population because they were part of the statistics. Number immigrant population varunade ullu. So is this the same for us? I don't know. I don't know what the menopause in India is, but this is the Australian average. So not necessarily for us. So 80% of the women in Australia have symptoms, menopausal symptoms. 25% have severe. And out of this 80% or the 25%, only 20% actually seek help. The symptoms can last about 4 years. So some people have up to 10% of them have up to 12 years. 1% of the women in Australia will have early menopause. That means under 40 years. Do you know what will happen if you get menopause before 40? Do you know why we worry about it? That if you get a menopause early, you get osteoporosis. So the brittle bones, so you can have a fall, even a minimal trauma, and you can have fractures. So that's why we worry about it. So we would really be worried about this 1% of women who have early menopause. Okay, they have treatment they need to come for. 30 to 40% of the woman's life is post-menopause. So the average person, if they live up to the age of 80, at 50, you're midway. That means you have another 30 to 40 years with menopause. So it is really important that we know what's happening with us. So we all experience menopause differently. Okay? So you also need to know, remember I just said that if you get your menopause earlier, we have a problem. So premature and early menopause. So premature menopause is that your last period is before the age of 40. So if you have not had periods when you're early 40, so before you're 40, if your period stopped, please go and see a doctor. It is very important that you see a doctor. Early menopause is your final period between 40 and 45. Menopausal symptoms are often more severe, depends on when your period stopped. You need to reduce the risk of cardiovascular disease, osteoporosis, and dementia, and ease the symptoms. For this, you need to get healthcare, and you need to go to the doctor. We have medicines available, and you can do this. Right? So remember, you see a doctor if your period stopped naturally before the age of 45. You will need treatment because you've lost estrogen. If you don't have estrogen, you're going to get osteoporosis. Your risk for cardiovascular disease is already high. So me being of Indian descent, I already have automatically 20% risk for cardiovascular disease. That's just being Indian, nothing else. Okay, I'm the 4th generation. I've lived outside India. I've not even lived in India, but still the risk is there. I have 20%. So imagine with this, how much is your risk? So careful. So stages of menopause, you have perimenopause, you have menopause, you have postmenopause. Perimenopause is the time your body is running out of eggs, so you're just going into it. Then you have menopause, that is when you no longer have periods. And then you have postmenopause, that starts 12 months after your last menstrual period. So we check all of this and we monitor your health when this happens. So how do we diagnose it? So there is no test to diagnose menopause per se, okay? We can't test the blood or the saliva to test if you're in menopause. We only use the symptoms to guide us to see that you are going into menopause. So if you have irregular periods, if you have abnormal bleeding or bleeding between periods or even after sex, you need to talk to your doctor about it. If your symptoms worry or it is interfering your daily life, you still need to talk to your doctor. It is very important that you communicate your problem with your doctor. So most people, especially for us who come from Indian subcontinent or even Asian countries, they're very hesitant to talk to the doctors. But you've got to understand, we all studied this in med school. So even if you come to me with a problem, I'm not judging you. I know what you're going through. So why don't you go to a doctor and talk? Right? So these are the 7 dwarfs of menopause. You have the itchy, you have the bitchy, you have the sweaty, you have the sleepy, you have the bloated, you have forgetful, and the psycho. Do you know why we call them like this? Because we get very angry, we always sweat a lot, we sleep a lot, we look bloated most of the time, we are forgetful, and we completely go psycho at times. So that's why you have all of them. That's called the 7 dwarfs. So what are the menopausal symptoms? So you can have physical, you have mental. So the physical symptoms are hot flushes and night sweats. So what is hot flushes and night sweats actually means? Do you know what night sweats mean? Arya, arkele night sweats and
Wait, is it like orkatila that you sweat too much and get up?
How do you know you sweat so much?
I mean, like
What?
just feeling wet.
You actually will wake up from your sleep and you would be literally drenched in sweat. Okay? So when it happened to me, I thought someone put water on my bed. How can it possible to sweat that much? This is what they call about all the night sweats. So now I understood. So hot flushes, what does hot flushes mean?
Like you feel cold and sometimes you feel hot.
Exactly. So it's very difficult to maintain the body temperature. So sometimes you feel extremely hot, and that's when everybody else is feeling like the hypothyroid and hypothyroid similar symptoms. So you have that hot, that cold weather intolerance. So dry vagina is common. Migraines, aches, and pains are also very common in women. Sleep disturbance, it does affect your sleep. So kind of like a depression, you have difficulty going to bed. You might wake up in the middle of the night, or you wake up very early in the morning and cannot go back to bed. Immune options in there. Then bladder problems, and you have central weight gain. What does central weight gain means? You've seen me, right?
Yeah,
I gain weight
tummy.
on my tummy and my back. That's it. I haven't done anything extra to me, and the fat has just decided that it will stay where it needs to be. And there's a reason why it's going there. Does any of you know why we gain weight centrally as we grow older?
Because during the delivery, the pelvis.
Other movie, though, correct. You're almost on track. But there's a reason why we gain so look at all our grandparents or great grandmothers. They were all heavy on the tummy and on the back, on the buttock, right? There must be a reason. Evolutionary, there must be a reason for us to gain weight there. Other than Rio, to protect us from hip fracture. നമുക്ക് ഏറ്റവും കൂടുതൽ fall ഉണ്ടാകുമ്പോഴും ഏറ്റവും കൂടുതൽ bone fracture ഉണ്ടാകുന്ന ഹിപ്പാണ്. I know the reason for it, but I'm not happy with it. There's nothing I can do about it. So I will wait for the hormones to settle, and hopefully eventually the fat goes somewhere. If not, I will cry every night. So crawling or itchy skin. The dry skin why estrogen keep your skin moist. As the estrogen grows down, you're going to feel the skin very itchy and dry, which is going to be common too. So you can be bitchy and have an itchy skin. Okay, emotional problem are going to be, you can feel anxious, you can feel irritable, your mood is lowered, you have mood swings, you have trouble concentrating, and you lose interest in sex. ഇത് മുഴുക്കനെ ഡിപ്രഷന്റെ symptom ആണ്. So the same symptom you can get if you're depressed. So അതുകൊണ്ടാണ് menopause is difficult for women, because we don't know what is happening, and then nobody understands us either. Right? So this is what we're looking at. So irritable corpunda, mood swings in corpunda, and then trouble concentrating, and then obviously less interest in sex. How many of you remember your own mother's menopausal period? Were you even aware? Did you think about what they went through? Because we were not merciful to our mothers. It would have been horrible for them. Most of the women, especially if they were in Kerala, all those places where it was not talked about it, they themselves didn't know what they were going through, and there was no support available. But that doesn't mean that we got to go through the same thing. We have support available, help available, and we need to reach it. I certainly remember what my mother went through, and I was in med school when this happened, and no part of me. Amma told me one day that when she wakes up in the morning and she puts her foot down, കൊച്ചെ രാവിലെ എണീക്കുമ്പോൾ എൻ്റെ കാലിൻ്റെ പാദത്തിൽ വേദനയുണ്ടെന്ന് പറഞ്ഞു. അപ്പം ഞാൻ എൻ്റെ അമ്മയോട് പറഞ്ഞു, ക്ലാസിക്കായിട്ട് ഫസ്റ്റ് ഇയർ അല്ല അന്ന് തേർഡ് ഇയർ മെഡിസിനാ. Third year medicine, I told her that, Amma, that's in your head. It's not possible. Ipo plantar fasciitis ennaanu സ്വന്തമായിട്ട് എക്സ്പീരിയൻസ് ചെയ്തപ്പോൾ മനസ്സിലായി, and now it's too late to go and tell her, I'm sorry I said that. So, but we do things like that. So that's normal. So how do we manage menopause, especially in Australia? So menopause management, there's multiple things we got to do. We can do the lifestyle. We can do the menopausal hormone therapy. Pandi the hormone replacement therapy na paranjirunne. Now we moved that to menopausal hormone treatment. We have non-hormone treatment. We have the treatment for vaginal dryness. You can have complementary therapies and pharmacy compounded chemicals. I'm not happy with that, so I won't go with that. Other alternative therapies on the law. So it has not been evidenced. There's no evidence for it, so I wouldn't agree to it. So what is menopausal hormone treatment? Are you in the menopausal hormone treatment? Okay, so it's usually earlier we had oral contraceptive pills, right? Similar way, you're now starting people on same as hormone replacement therapy, name change to menopausal hormone treatment. And then we are giving so it'll have different combination estrogen. So whether you still have your uterus or not, then you give the medication according to that. So you relieve the menopausal symptoms, and it works. So you can use it as a pill, you can use it as a gel, you can patch, or vaginal creams, tablet, or pessaries. All these options are available in Australia, and it is all covered by Medicare. So you should get it. And it can be taken in the lowest effective dose as long as you want it. So there are a couple of guidelines we need to know, so which I should have it here. Okay, so menopausal hormone treatment, MHT, is really important. But if you have had blood clots or if you had personal history of breast cancer or gallstone, you can't take this. When you go to the clinic, when you talk to the doctor, they usually ask if you had blood clots or if you had your personal history that you yourself had breast cancer or if you had gallstones. Then there's other alternatives for it. It's not that the world ends, but there will be other things that you can take. So then also you can take non-hormonal option. Remember that earlier when I told you that the symptoms are very similar to depression? So if the symptoms are similar to depression, then obviously the antidepressants would work, correct? So you have the blood pressure. So you need to do the antidepressant. You have the clonidine for the blood pressure medication. Sometimes, if worst cases, you can give the gabapentin and other epilepsy medications. All right. So menopause and sex, this is something not many people talk about it. You need to know that sex can be painful if you have menopause, and there are treatments available. The reason why sex is painful when you have menopause is that because there's no estrogen. So the vaginal walls are going to be dry and can be rough. So there is medications available. So you need to be able to go to the doctor and get those scripts. Please don't suffer in silence. There are treatment available. And it's not embarrassing. It's not to be scary. Every woman go through this, get the help you need. So go to see the doctor. So if there is painful sex, these are the options you have. You have the lubricants. You can take the menopausal hormone treatment. You can do the relaxation techniques, pelvic floor. How many of you know Kegel exercise? When you gave birth in the hospital here, did anyone teach you to do Kegels? Did they tell you that you must do Kegel exercise? And how many of you actually do it?
I probably did it for like a day after the delivery.
Loro? Anybody else? So why did you think you were asked to do Kegel?
To strengthen your bladder?
Almatrallo. Baki?
I
Arilla.
think
Pelvic
avoid,
floor. Okay,
I
so
think avoid incontinence of urine.
yeah, in Almatrallo.
I know only one point.
Okay, that's okay. Pelvic floor in so you have the pelvic floor, right? So that is where the pelvic floor is holding your uterus, your bladder, and everything. Upon pelvic floor in the muscles relax, you're going to have prolapse of your uterus. Pinna bladder and incontinence and down. So Kegel exercise you need to do every single day of your life from the time you give birth to now. It's already late. So if you haven't done it, you have to start doing it now. Okay, every day you need to do 15 sets times 3. വെറുതെ പോയി having prolapse അതിന്റെ surgery എടുക്കുന്നതിൽ എത്ര എളുപ്പം. Every time you go under the knife, your risk of multiple problems increases, right? I look at prevention is better than cure, so don't have a prolapse of the uterus. You do the Kegel exercise. There are plenty of YouTube videos. If you don't know how to do it, come and see me and I'll teach you how to do it. But you need to learn to do it. Most of the hospitals will teach you how to do it. നിങ്ങളെ ആരും പഠിപ്പിച്ചിട്ടില്ലേ വേറെ ആരെ ഹോസ്പിറ്റലിൽ? How many of you gave birth here? If you give birth, they will teach you how to do it.
No, I don't think so. I gave birth. My third delivery was here, but I just remember them talking about it. But they don't like practically show you. I have not experienced, but I'm not sure in other hospitals.
കഷ്ടായിപ്പോയി. But you know that have you at least heard of Kegel? കേട്ടിട്ടുണ്ടോ ബാക്കിയുള്ളവർ ആരെങ്കിലും? No? So Kegel is the pelvic floor exercise and you must do it. There are bare minimum things for you to do to be healthy. One of it is Kegel. So every morning before you get up from the bed, you do the Kegel and then you get up, you sit for at least 30 seconds. This is something you have to practice from the time you're in your 30s to 40s. Why have I asked you to sit in the bed for 30 seconds before you get up? There must be a reason, right? To prevent postural hypertension. So what makes all of us end up in the hospital is falls. ഇപ്പം നിങ്ങളൊക്കെ health care system work in nurses ആയിട്ട് work ചെയ്യുന്നുണ്ടല്ലോ, majority of the older patients that are coming to you are because they have had a fall, right? Why have they had a fall? One of the biggest causes is postural hypertension. So we don't practice that certain things. But your blood pressure will not equalize. Postural hypertension. Postural hypertension means when you're lying down, your blood pressure is at a certain level. When you stand up, it drops very quickly. You feel giddy and you have dizziness and you fall. So if you practice every day, the practice very silently. They just didn't tell you that. So they knew that. They were all following it. I was very impressed when I used to watch my grandmother, because every day when she got up, she sat down, she prayed, and then she got out of the bed. But we forget to do that. So we get up immediately, and that's when the posture drops. So learn to spend at least 30 seconds for yourself in the morning, sit down, and then do it. I get to do this 5 times a week, and the other 2 times I forget. So I've been tracking my own progression, so I don't practice what I preach. So pelvic floor physiotherapy, sitting down when you get up, and then see a doctor. Seeing a psychologist or a sex therapist, both are covered under Medicare. You can still get it. Contraception. So this is something that most people don't talk about it, and that's why we always have women accidentally falling pregnant in their 50s when they don't want, even when they don't want to. So just because your periods are stopping doesn't mean that you are not ovulating. You may still ovulate. So adinu contraception undavanam. Either you use condom or you take the pills to stop you from ovulating. So if you don't want to become pregnant, use contraception 1 year after your last period if you're older than 50, 2 years after your last period if you're younger than 50. This is the Australian guideline. Okay, so periods stop on the top in the don't think that you won't get pregnant. You might still get pregnant, so take contraception. So you need to talk to your doctor what is the right contraception and protect yourself from STIs. Health after menopause. Okay. So postmenopausal period is the best time in your life because most of your children would have left home and you can enjoy life with your partner like I do now. However, you still need to have good health to prevent cardiovascular disease, osteoporosis, central weight gain, type 2 DM. Estrogen. If you don't have estrogen, obviously your risk of cardiovascular disease is going up. Osteoporosis, because estrogen is needed for bone to keep the calcium in. If you don't have estrogen, your calcium is going out. How many of you are taking vitamin D every day currently? How many of you? One person. I can see if you do. You can actually do the sign.
Used to take, just stopped in between.
Stop it.
Forgot to buy a new one.
Okay, why am I asking you for vitamin D? And why am I asking you to take it? Because if you understand the reason, you probably will. Most of us who have ancestry coming from India or Pakistan, wherever we are from, it doesn't matter. So we come from the equator area of the earth, right? So we are close. Sun rays 12 hours and hitting. So we didn't need to absorb vitamin D properly. There was sun and you were still getting it. Unfortunately, our body doesn't absorb vitamin D from the gut. But you're wearing a full sleeve, you're inside the house majority of the time, and you have less sun exposure first of all. Plus, that is not going to be absorbed properly in our skin because we also put all of the sunscreen and everything. Our vitamin D is going to be really, really low. Have you had your blood test to see what your vitamin D level is? Normal or sitting in the borderline?
Sitting below.
Just low.
Vitamin D born in the calcium. So don't you? Because later your option is you're going to have osteoporosis. Osteoporosis വന്നു കഴിഞ്ഞിട്ട് പിന്നെ കഴിഞ്ഞിട്ട് കാര്യമുണ്ടോ? ഇല്ലല്ലോ. വരാണ്ടിരിക്കുകയല്ല നമ്മൾ ചെയ്യേണ്ട. അപ്പം every day that you are deficient in vitamin D, calcium is leaving your bone. നമ്മൾ ബ്രസ്റ്റ് ഫീഡ് ചെയ്തിട്ടുണ്ടാവും. നമ്മുടെ ഡയറ്റ് ഓൾറെഡി poor ആണ്. കാരണം നമ്മൾ കഴിക്കുന്ന ഭക്ഷണം is not as rich in calcium. So diet is poor. We have already breastfed or we have had children, so our calcium level is dropping anyway. If you don't take vitamin D, it's going to go down. So go to the GP, get your vitamin D level. Even if your vitamin D is still is at borderline, you can take എല്ലാ ഫാർമസിയിലും ഉണ്ട് 1000 international unit. അത് കഴിക്കുക ദിവസം ഒന്ന് അത് ഇനി മറക്കുകയാണെങ്കിൽ there is 7000 international unit in the tablet ഡോക്ടറുടെ സ്ക്രിപ്റ്റ് വെച്ച് കിട്ടും. It's still covered. I think it'll cost you about $20 and 7,000 international unit once a day or once a week. അതെങ്കിലും കഴിക്കുക. Look, if anything happens to your children or your partner, who will take care of them? You, right? If anything happens to you, who will take care of you? The reverse is never true. No, I tease my husband always because if I have a fever, he will ask, have you taken Panadol? If he has fever, he will ask me to check the fever every 5 minutes. You know, that have you taken the Panadol won't work. I have to constantly monitor. He'll ask, open your door, he'll come. So that's the difference. Okay, so remember I told you a third or even half of your life will happen after menopause. That means if you're 50, on average life for expectancy for a Malayali woman is 86 or 87 on it. So 50 to 86, another 36 years you're living minimum, bare minimum. About 36 years, you need to be healthier and happier, and you need to take care of your own health. No, I must have, no, postmenopause, okay. Postmenopause weight and shape. They say menopause doesn't cause weight gain. That's what the science says, but I don't agree to it because from the time I can remember, so at least from the age of 30 to now, I've eaten exactly the same food, the same quantity, but I have put on 12 kilos of weight. If menopause doesn't, there's something else happening because I don't know how that happens. So change in your body shape because more weight is around your hip line. It's just, I don't understand how the fat decides that I must go straight to Sarah's hip and stay there. And it increases some of the chronic conditions risk. Healthy diet. Our diet, Malayali diet is very poor. Why do I say Malayali diet is very poor?
Because we eat a lot of carbs.
Breakfast carbs on it, lunch carb on it, dinner carb on it. Okay. What else is our diet poor?
Timing.
Dinner?
Late dinners.
That is so true. Dinner? അത്രേ ഉള്ളൂ നമ്മുടെ ഡയറ്റിന്റെ ബാഡ് ആയിട്ടുള്ള നോ നത്തിങ് എൽസ്
Changing into the more amount of what you say junk food.
My grandmother had kani and pyre every night and she lived to the age of 93 and she still could chase me around the house if I talked back to her. Okay, and because she worked hard and she still lived healthy and I think they all followed a lot of Ayurveda lifestyle where she ate before 7 o'clock. Before sundown, she had her dinner. And the next morning her breakfast was at 7. So she already practiced that intermittent fasting, but intermittent fasting is not good. So evidence has said that that's not good. But the 12 hours of fasting was beneficial for her. Are we doing that? No. Our diet is very, very poor because we are time poor. നമുക്ക് നമ്മുടേതായിട്ടുള്ള alternatives ഇല്ല because I can't go to the shop and buy something that suits my taste. It's all the Western food and that is not meant for us. So we don't have alternative. We eat a lot of carbs, unnecessarily a lot of carbs. So we start with rice in the morning. So at least most of the ingredients for that breakfast you have is rice. Then you have rice for lunch and then you have rice for dinner. So what can you change in that would suit your own health? So what are you going to do? I had asked someone to send me diet plan because diet plans are in India is a big thing. And she sent me like all these dosas that can make from other things other than rice and who has the time and who has the interest. So that's not going to work. So what can work for us? Is not a solution nowadays.
Portion control.
So what do you mean by portion control?
Instead of having 4 idlis, make it half or
That's
one.
good.
Yeah. But increase the sides like sambar or can be increased.
Okay, what else? Because whatever we as women cook is what our children and our partner eat. So when you cook, how do you make sure that they are eating healthy? ഒരു പച്ചക്കറി കിട്ടിയ അതിനെ അടിച്ച് കൊന്ന് അത് ആവിയിലും കയറ്റി വെള്ളത്തിലും വേവിച്ച് അതിന്റെ end product അല്ലേ നമ്മൾ കൊടുക്കുന്നത്? There is no nutrition in any of our torrents, right? Because you boiled so much that all of the vitamins are gone. So you need to reorient your own cooking to see how best to feed your family. Because you have to, you're responsible for the health of your children and your husband. So when you cook, you need to think, how much oil am I putting in? How much salt am I putting in? What am I cooking? Is this balance for me? And is this balance for my husband? Is it balance for my children? Because your children also have to live in this world and they have to live healthy. So portion control is one. Second thing is to know what ingredient is going in. So you can figure out. And third option is that every one of you have a right to go and see a dietitian. So talk to your dietitian, see what you're eating and how to modify each of it. And that will help. And that is part of your healthcare plan. So if you go to, because all of us, I told you, being of Indian descent, we already have a cardiovascular disease risk. That simply means you can get a diet plan from the dietitian. So go to the doctor, ask for a health plan, and then get to the dietitian and figure out what you do. Keep a healthy weight. Not something I have been successful. My BMI is 27, so I usually have an appointment. A friend of mine is a cardiologist. I go and see him once in a while. So he said, your BMI is 27. What do you think of that? And I asked him back, what do you think of that? So we both are thinking about my BMI 27 because I'm now considered overweight. Okay, so I don't really look that fat, but I am overweight, technically speaking. So my risk is very high. So don't smoke and reduce your alcohol. Health check, we need to do the regular blood check. Oh, sorry, the blood pressure. You need to check your cholesterol, your blood sugar. How many of you have tested your blood sugar? Test because we have high risk of diabetes genetically. So you need to do that. Bone health check. So DEXA. So you can get the DEXA done if your vitamin D level is low, and you can have that. Skin check, breast screen is mandatory. 50 after the age of 50, you get 1 mammogram every 2 years. And if you go to the Q scan or one of them, that is free. There's only one place in Brisbane that has it. Indooroopilly has their breast screening center, and that's free. You don't have to pay for it. So after the age of 50, every 2 years, you need to have breast screen. Cervical screening test, how often do you have to have it? When was the last time you had it? How many of you have had your cervical screening test?
Every 5 years.
ചെയ്തോ അടുത്ത സമയത്തെങ്ങാനും
I can't hear you.
You need to get it done. And a bowel screening test, when do you have to do it? The poop test or stool test?
After 50?
How often?
5 years?
2 years. Every 2 years you got to get it done.
Yes. Is that part of the Medicare as well?
50 line. Okay. So if you have a family history of bowel cancer, after the age of 45, you can go online, a bowel screening test, and you can order the bowel screening test and it'll come to you by mail. Otherwise, when you turn 50, it'll come by mail every 2 years for you. But family history on England, go online, you can do it. So when to see a doctor if you have bleeding after menopause. So after you have not had bleeding for 12 months, then we confirm that you have menopause now, right? So if you have had menopause and if you have a bleeding, it is really important that you go and see a doctor because that's not normal. So 12 months of no periods and you have periods after that, or if you have a little bit of bleeding, go and see. If you have postcoital bleeding, that means after you have sex, if you still have bleeding, you need to go and see a doctor. Urinary incontinence, you still need to see a doctor. മനസ്സിലായോ? Okay. So the hope of a menopausal hormone treatment is to go from here to this. I rest my case. Happy? Any questions?
Can I just ask a quick question? When you talk about the bone health check, is it after the age of 50 as well?
Yes. Preferably after the age of 50. And also if you have, sometimes when patients have minimal trauma fracture. Minimal trauma fracture means a fracture without a fall or things like that. Then you need to have a bone scan done immediately because we need to know what's going on. And then we evaluate for secondary causes of osteoporosis. So
So
that's maybe
vitamin can, so are you saying vitamin D can help with osteoporosis as well?
you have to have your vitamin D. You must have it because vitamin D will allow calcium to be absorbed in your system, and that absorbed calcium will go into your bone, keep your bone healthy. You don't have vitamin D, no calcium is absorbed, body needs calcium, calcium is taken out of the bone. So that's why you get osteoporosis.
So what about for men in terms of vitamin D? Sorry, I'm just
They also
asking because
they
I'm
also
sure.
need vitamin D. Actually, men also are at a risk of osteoporosis, so they should. But their diet is a little more better than us, and because they don't breastfeed, our calcium loss a little because of the natural cycle. So that's where it's a little more less likely they get osteoporosis, but we get it. So
But it's
minimal
worth getting their check, the vitamin D check.
have to get it. Minimal trauma fracture simply means that you don't have to do anything and the bones are still breaking. So if you don't have if you have osteoporosis, then you get to that stage, your quality of life is going to deteriorate. And we don't want to be a burden to our children, right? So you need to be healthy yourself. So otherwise you'll end up in the aged care home. And like I told you in the last time, my dream is never to end up there because I will not eat broccoli and cauliflower. I have to eat my kanya and pairu. And kapai mingri. Any other questions?
Sorry, open to the public, open to the podium to ask any more questions, please.
What is a normal, like vitamin D? If it is in 20s, do we need to take every day the vitamin
Depends on
supplement?
your level. So what is your vitamin D level? So on an average, even if you haven't checked, you can still safely take 1,000 international unit a day. That's a
Okay.
normal requirement. So you get all of the tablets that you find in the market on the over the counter is 1,000 international unit, and that is safe for you.
Yeah.
For
So
some, that's not enough.
we don't need to check, like if we taking that vitamin D every day, do we need to check like every 6 months or something, or?
You have to check. You have to know what your vitamin D level is. You have to be on top of your vitamin D level. You need to make sure that it is always, because I personally was lazy and I got my vitamin D checked because my GP said, I'm going to get it checked. Mine was 34. And that was really, really, really low. So then they gave me 55,000 international unit, one single injection, because there wouldn't have been any calcium left in my bone. And I was 41 when my vitamin D level was that low. So that was risky. That was stupid of me. I should have, should have, would have, could have, would have, we can always say that, but I personally did that to myself and I learned. So now I tell others, don't do what I did. Know your vitamin D level. Even if Medicare doesn't pay for it, it's only $27 to do the vitamin D level. Even if you have to pay for it, it's not that expensive. It's one blood test.
Doctor, can I also just add, I have, just from my experience, I think it is also worth getting our kids' vitamin D checked because I am giving vitamin D for my kids as well because the last time ഞങ്ങൾ ജി പിയുടെ അടുത്ത് പോയപ്പം ഞങ്ങളുടെ ജി പി റാൻഡം ചെക്സ് ചെയ്യുമ്പോൾ എൻ്റെ പിള്ളേരുടെ എല്ലാം വൈറ്റമിൻ ഡി ലെവൽസ് ലോ ആയിരുന്നു ഈവൻ ദോ അവര് വെളിയിൽ കളിക്കുന്നുണ്ട്.
No,
Sorry, I
we
think
don't allow, not because us parents, but generally Australia, even in the school, when they go, they are always kept inside or they wear the hat because sun protection is really important for us. But the flip side of it is that you don't have vitamin D. Any other question? Anything else about menopause?
I guess the most important thing is seeking help, which
Yeah, you need to get help is available. Don't suffer in silence. And especially as Malayali women, we don't look for help, and which is really sad. And you see, most of us are in the healthcare field and we know what is available, and yet we don't go for help. Why are we suffering in silence? I don't know.
any more questions? Doctor, I think that's it.
Okay. Thank you
Okay,
for
everybody. Thank you, Dr. Sarah. Now I would like to invite Mrs. Gigi Sarjan for the word of thanks. And Gigi Sarjan is a member of the St. Mary's Malangra Indian Orthodox Church, Sunshine Coast. and also currently serves as the Secretary of the MMVS Queensland region. Over to you, G. Chechi.
ത്രിയേക ദൈവത്തിന് സ്തുതി. ബഹുമാനപ്പെട്ട വൈദിക ശ്രേഷ്ഠരെ, നമ്മുടെ ഗസ്റ്റ് സ്പീക്കർ ഡോക്ടർ സാറ, നമ്മുടെ കുടുംബാംഗങ്ങളെ, നിങ്ങൾക്കെല്ലാവർക്കും ക്രിസ്തുയേശുവിൻ തന്റെ നാമത്തിൽ സ്നേഹവന്ദനം. ഈ സമയത്ത് നിങ്ങൾക്കെല്ലാവർക്കും നന്ദി പ്രകാശിപ്പിക്കാൻ വേണ്ടിയാണ് ഞാൻ ഈ അവസരം